This is the second part of pharmaceuticals, and let us see in this part qualities of an ideal drug. So, an ideal drug should satisfy the following qualities, then and then only it will be called as ideal drug. And the first one is the action of drug should be localized at the site where it is desired to act. That means the action of the drug should be on the part of the body which is affected or which is under diseased condition only. Second, it should destroy the causative microorganism without affecting host tissue. Then it should act on a system with efficiency and safety. Next, it should not have toxicity. That means toxicity to the host. It should have minimum side effect. If at all side effects are there, they should be minimum. It should not injure host tissue or physiological processes. Then the causative microorganism should not acquire resistance or tolerance to the drug after some period. It should be bactericidal rather than bacteriostatic. It should have higher potency and specific action. It should be stable, safe, and effective. The mode of application of drug must be easy. And last one, it should be cheap. However, in practice, no drug in the market till today behaves as an ideal drug. Then what is chemotherapeutic index CI or therapeutic index TI? The ideal chemotherapeutic agent is considered to be one with selective toxicity to the parasite and non-toxic to the host. That means it is toxic to positive agent of the disease and it is not toxic or non-toxic to the patient's body. As no such agent exists, the relative efficiency and safety of chemotherapy agent has been indicated by chemotherapeutic index or therapeutic index. It is expressed by the relation chemotherapeutic index is equals to maximum tolerated dose by the host divided by minimum curative or effective dose. So, chemotherapeutic index is defined as the ratio of maximum tolerated dose to minimum effective dose. Higher the ratio, that is chemotherapeutic index, higher the TI, the better will be the drug because of the greater safety to the patient. The chemotherapeutic index of 10 means that 10 times of the dose used for curative purpose would kill the parasite as well as patient. So 10 means 10 divided by 1. If one tablet is taken by the patient, it is effective against parasite. But if 10 tablets are taken by the patient, the tablets or the drug or that medicine kills both parasite as well as host or patient. A chemotherapeutic index is useful for comparing structural analog and drugs having similar metabolic feats. Then methods of classification of drugs, classification on the basis of chemical structure. On this basis, drugs can be divided, or their types are acid drugs, alcohols, amines, amides, amino acids, amino alcohols, amino ethers, esters, phenols, quinones, ureas, thioamides, urethanes. That means their functional groups are used for their classification. Second method is classification on the basis of therapeutical action. Classification of the drugs on the basis of their chemical structure is only suitable for studying their chemical properties. Synthesis and not for their therapeutical action. On the other hand, classification based on therapeutical action does not give idea about the chemistry of different functional groups present in the drug, and this is disease oriented classification of medicinal compounds or drugs. And according to their therapeutical action, the drugs are classified into following groups: CNS, that is central nervous system, or psychopharmacological agent. CNS or psychopharmacological agent. Then second class is pharmacodynamic agent or pharmacodynamic drugs. Third class is chemotherapeutic agents or chemotherapeutic drugs. And fourth class is metabolic diseases and endocrine function oriented drugs or drugs used for metabolic diseases and endocrine dysfunctions. These are the classes depending on their therapeutic action. Thank you.